Good afternoon, Kevin Langer. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
You can now start your OET roleplay.
Good afternoon, Mihira. It's good to see you again. How are you feeling today?
Hi, I'm good. Thank you for asking.
Great. Well, Mihira, could you please confirm the reason for today's visit?
Yes, I'm here for the follow-up appointment, and now the doctor confirmed that the stitches can be removed. And I wasn't sure if it was time, but the doctor said that's fine to be removed.
It's quite natural to feel so. Let's take this step by step and make sure everything is healing as it should. Do you have any concerns regarding the wound or healing process?
I've been feeling a bit anxious, honestly. I've been worrying about the wound on my hand. It still feels a little tender, and I'm not sure if it's healed properly.
I completely understand your concern, Mihira. Dog bites can be stressful, especially when it involves stitches. But yes, you're right on time. Before we proceed, though, I'd like to know about how the wound has been doing.
Well, I recovered well. There was some redness at first, but it seems to have gone down. It still feels a little sore when I touch it, but there hasn't been any swelling or discharge.
That's really good to hear, Mihira. It sounds like the healing is progressing well, and what you've described is quite normal. Some tenderness and slight redness are expected, especially in the early stages. The fact that there's no swelling or discharge is a great sign. It means there's no infection, and the wound is healing properly. Apart from that, typically, stitches are removed around 14 to 21 days after they've been put in, depending on how the wound is healing. Moreover, the doctor has assessed your wound and cleared it for removal today.
That's a relief to hear. Does it hurt when you take the stitches out?
Good question. Most patients say they feel mild discomfort, but it's generally not painful. The process is usually quick, and I'll make sure to be as gentle as possible. After the stitches are out, we'll want to focus on proper wound care to ensure everything continues to heal smoothly. Do you have any concerns or questions?
Okay, that sounds fine. What do I need to do after the stitches are gone?
That's a good question, Mihira. After the stitches are removed, it's important to keep the area clean and dry for a few days. You can cover it with a light dressing to protect it from friction or irritation, especially if you're doing anything that might expose it to dirt or germs. I'd also recommend avoiding any strenuous activities that could put a strain on your hand for at least a few days. If you have some antiseptic cream at home, you can apply a thin layer to the wound to keep it clean.
Got it. How about the wound scarring?
Yes, once the wound has fully healed, we'll want to focus on scar management. You can start applying a moisturizing lotion to keep the skin hydrated, which helps with healing. Some patients also use silicone sheets to reduce scarring, which can be very effective. Also, make sure to avoid direct sunlight on the area, as that can darken the scar and make it more noticeable.
That's helpful. I hadn't thought about sunlight. I'll make sure to cover it up.
I'm so glad to hear that, Mihira. Do you have any other concerns or questions before we go ahead with removing the stitches?
No, I think you've covered everything.
Great. Now that you're feeling more comfortable. Mihira, can I confirm that you're okay with me proceeding to remove the stitches?
Yes, I'm ready. Let's go ahead.
Perfect. I'll get started now. Before concluding, let me summarize what we have discussed so far to make sure everything is clear. You've come in today to have your stitches removed after the dog bite, and the wound is healing well, with no signs of infection like swelling or discharge. You mentioned some tenderness, but that's normal at this stage. The stitches will be removed today, and you might feel a little tugging, but it shouldn't be painful. After the removal, it's important to keep the area clean and dry for the next few days, avoid any strenuous activities with your hand, and cover the wound lightly to protect it. You can also apply antiseptic cream to keep the area clean. Once the wound fully heals, we'll move on to scar management, using moisturizing lotions or silicone sheets and avoiding direct sunlight to reduce scarring. Lastly, you've agreed to have the stitches removed today, and if you have any other concerns or questions, I'm here to help.